These nutrients are so essential to the basic integrity and viability of our biology that we can't afford to ignore them. The Inuit had a diet extraordinarily high in fat, primarily from marine animals like seals, whales, and cold-water fish. Yet paradoxically, they had strikingly low rates of heart disease. Studies have shown that EPA and DHA can lower triglyceride levels by 20 to 30%, which is remarkable for something that comes from food. Observational studies consistently link higher omega-3 intake to slower cognitive decline and a reduced risk of dementia. There are likely very few people living in the modern world who wouldn't benefit from optimizing their omega-3 status. My name is Dr. Ravi Kumar. I'm a neurosurgeon in search of the causes of human illness and the solutions that help us heal and thrive. I want you to join me on a journey of discovery as I turn over every stone in search of the roots of disease and the mysteries of our resilience. The human body is a mysterious and miraculous machine with an amazing ability to self-heal. Let us question everything and discover our true potentials. Welcome to the Dr. Kumar Discovery. My name is Dr. Ravi Kumar, and welcome to the Dr. Kumar Discovery Podcast. In this episode, we're diving into one of the most overlooked yet foundational elements of human health, omega-3 fatty acids. These nutrients are so essential to the basic integrity and viability of our biology that we can't afford to ignore them. Omega-3s are essential fatty acids, meaning our bodies need them but cannot make them, and they play a role in everything from brain development and cardiovascular health to immune function and inflammation regulation. In fact, I believe omega-3 intake should be a standard part of every medical evaluation. It's astonishing how often this pivotal, easily accessible nutrient is ignored in favor of medications that merely mask symptoms. And it's why I want every listener of this podcast to walk away with a new understanding of just how essential omega-3s are for your ability to thrive in this world. Before we begin though, a quick disclaimer. I am a medical doctor, but I'm not your doctor. This podcast is for informational purposes only. It's not intended to diagnose or treat any medical condition. My goal is to provide you with the most unbiased, evidence-based, and common sense information possible so you can make informed choices about your own health. Let's start with the basics. Omega-3s are a type of essential fatty acid, meaning your body cannot produce them on its own. You have to get them from your diet. They're part of a broader family called polyunsaturated fatty acids, which are characterized by having multiple double bonds in their chemical structure. The name omega-3 refers to the position of the first double bond. It occurs at the third carbon from the omega end of the fatty acid chain. That structural detail plays a key role in the shape of these fats and how they behave in the body, especially in our cell membranes. There are three main types of omega-3 fatty acids relevant to human health: ALA, also called alpha-linolenic acid, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. ALA is a short chain form and is found in plant sources like flax seeds, chia seeds, and walnuts. EPA and DHA, on the other hand, are the long chain forms that your body actually uses for most of its biological functions. These are found in marine sources like fatty fish, krill, and marine algae. Now here's the important part. While your body can convert ALA into EPA and DHA, the process is highly inefficient. On average, only about 5 to 10% of ALA is converted to EPA, and less than 5% becomes DHA. This means that relying on plant-based sources alone for your omega-3 needs may not be enough to achieve optimal health. Evolutionarily, humans likely met their needs through direct intake of EPA and DHA, primarily from seafood and even from the brains and fat of land animals. So what do these long-chain omega-3 fatty acids actually do in the body? Well, let's start with DHA. It's a major structural component of nerve cells and retinal tissue. It helps maintain membrane fluidity in neurons and supports the formation of synapses, those vital connections that allow the brain cells to communicate. Without enough DHA, the brain and eyes can't develop or function properly. EPA and DHA are also involved in regulating inflammation. If you remember from earlier episodes, we talked about how omega-6 fatty acids are pro-inflammatory, while omega-3s are anti-inflammatory. An important concept here is that inflammation is not bad. It's essential for healing, but we need to resolve it once the job is done. EPA and DHA are converted into compounds called specialized pro-resolving mediators like resolvins, protectins, and myrisins. These molecules help cool down inflammation and bring the immune response to a close. Omega-3s are also important for brain health and mood. They influence neurotransmitter function, support neurogenesis, modulate neuroinflammation, and have been shown to play a role in prevention and treatment of depression. Finally, omega-3s are critical for cardiovascular and metabolic health. They help maintain proper inflammatory balance within the blood vessels and metabolic tissues. Without adequate omega-3 intake, the risk of heart disease and metabolic dysfunction increases substantially. So how did we first discover the importance of omega-3 fatty acids in human health? Hey everyone, I hope you're enjoying this episode so far. I got a small favor to ask. This podcast only makes a difference if it reaches the people who need it. And in a world where health information is often confusing, biased, or incomplete, that mission matters more than ever. I'm doing this to learn, to grow, and to share what I find with you. So if something here has sparked your curiosity or helped you think differently, please share this episode with someone who might benefit. And if you can, leave a rating or a comment on your podcast app. It really helps spread the word. Thank you so much for being a part of this journey. The story of omega-3 fatty acids begins nearly a century ago. In the 1920s, two scientists, George and Mildred Burr, were studying rats and discovered that removing certain fats from their diet led to severe health problems, including scaly skin, poor growth, and organ dysfunction. These fats, which we now call essential fatty acids, included both omega-6 and omega-3 fatty acids. The Burrs were the first to demonstrate that fat could be essential to life, on par with vitamins and minerals. While omega-6 fats got most of the attention at first, the significance of omega-3s wasn't fully understood until the 1970s, when Danish researchers Hans Olaf Bang and Bjorn Dyerberg began studying the Inuit population in Greenland. The Inuit had a diet extraordinarily high in fat, primarily from marine animals like seals, whales, and cold-water fish. Yet paradoxically, they had strikingly low rates of heart disease. This was despite having high cholesterol levels and a heavy smoking habit. Their cardiovascular health directly contradicted the dominant theory of the time, that dietary fat caused heart disease. Intrigued, Bang and Dyerberg surveyed their diets and collected blood samples to analyze their fatty acid profiles. What they found was that the Inuit were consuming massive amounts of long-chain omega-3 fatty acids, EPA and DHA, from their marine-based diet. As a result, they had low triglyceride levels, elevated HDL, and minimal signs of heart disease. In short, their metabolic health was exceptional. When the researchers compared these findings to Inuit who had relocated to Denmark and adopted a more Western diet, the contrast was stark. Those living in Denmark developed lipid profiles and cardiovascular disease risk similar to ethnic Danes, confirming that the protective effect was linked to diet, not genetics. The Inuit weren't the only population to reveal this pattern. Japanese populations with diets rich in seafood also exhibited exceptionally low rates of cardiovascular disease, despite other risk factors like high sodium intake and widespread smoking. One large study followed over 41,000 Japanese men who were free of heart disease and tracked them for 11 years. It found that those with the highest omega-3 intake had a 65% lower risk of having a heart attack compared to those with the lowest intake of omega-3 fatty acids. This repeated pattern across cultures sparked decades of research into omega-3 fatty acids and their cardioprotective effects. From the Arctic to the Pacific, it became clear that these marine-derived fats were doing something remarkable inside the human body. So what does the clinical evidence actually say about omega-3 fatty acids? The short answer is a lot. Omega-3s have been studied extensively, and their impact on human health is far-reaching. They influence nearly every organ system. There's truly no tissue in the body untouched by their effects. So rather than list every possible benefit, let's focus on major areas where omega-3 fatty acids have shown strong clinical evidence, starting with the heart. Cardiovascular health is perhaps the most well-researched domain for omega-3s, especially for EPA, one of the two long-chain omega-3 fatty acids. Studies consistently show that EPA-rich formulations reduce cardiovascular risk, lower triglyceride levels, reduce inflammation, stabilize vulnerable plaques, and improve endothelial function. A landmark study in 2019, the REDUCE-IT trial, evaluated a prescription-grade purified EPA supplement with a dose of 4 grams per day in patients already on statins with elevated triglycerides. The results were striking. There was a 25% reduction in major cardiovascular events, a 21% reduction in cardiovascular death, and a 3.5 absolute risk reduction in death over 5 years. However, because the REDUCE-IT trial used a high dose of pharmaceutical-grade EPA, there was a modest increase in atrial fibrillation and bleeding compared to placebo. One of omega-3's standout features is their ability to reduce triglycerides. Studies have shown that EPA and DHA can lower triglyceride levels by 20 to 30%, which is remarkable for something that comes from food or supplements, not a pharmaceutical. Omega-3s have also been shown to reduce systolic blood pressure in individuals with hypertension and improve endothelial function by enhancing nitric oxide production. Nitric oxide is a signaling molecule that causes blood vessels to relax and dilate, improving blood flow and lowering blood pressure. Another important study called the EVAPORATE trial looks specifically at the effect of EPA on coronary plaque. Patients received 4 grams of pure EPA daily, and researchers used advanced CT imaging to track changes in arterial plaque. They found a 17% reduction in plaque volume over 18 months, not just halting atherosclerosis, but actually reversing it. Taken together, the evidence supporting omega-3s for cardiovascular health is robust and compelling. These aren't fringe studies. These are large, well-conducted trials, and they tell a consistent story. Omega-3 fatty acids, especially high doses of EPA, are cardioprotective. Another major area where omega-3 fatty acids play a critical role is brain development and cognition, especially in children. DHA, one of the long omega-3 fatty acids, is a structural building block of the brain and the retina. In fact, the retina, a specialized layer of tissue at the back of the eye that senses light, is among the most DHA-rich areas in the body. During the 3rd trimester of pregnancy, a developing fetus rapidly accumulates DHA as the brain and visual system form. This makes adequate maternal DHA intake during pregnancy especially important. Several clinical trials have examined this. In one study, pregnant women at 18 weeks gestation were randomized to receive either 10 milliliters of cod liver oil, which is rich in omega-3 fatty acids, or corn oil, which is high in omega-6 fatty acids. Supplementation continued until 3 months postpartum. The results? Children whose mothers took cod liver oil scored higher on intelligence tests at 4 years of age compared to those whose mothers had taken corn oil. Another trial found that 400 milligrams of DHA per day during pregnancy improved infants' problem-solving skills at 9 months of age. And when infant formulas are supplemented with DHA and arachidonic acid, studies show improved cognitive development and visual acuity compared to unsupplemented formulas, providing critical support for babies who are not breastfed. Even in childhood and adolescence, omega-3s continue to show cognitive benefits. For example, children with ADHD who received omega-3 supplements demonstrated improvements in reading, spelling, behavior, and parental assessment of overall function. In healthy adults, supplementation with DHA-rich fish oil has been shown to improve memory and reaction time, an effect that becomes even more relevant with age. Omega-3s really come into focus when it comes to aging and cognitive decline. Observational studies consistently link higher omega-3 intake to slower cognitive decline and a reduced risk of dementia. One study from the Alzheimer's Disease Neuroimaging Initiative followed 1,135 older adults who were free of dementia at baseline. Over 6 years, those who used omega-3 supplements long-term had a 64% lower risk of developing Alzheimer's disease. To put that in perspective, if a pharmaceutical drug offered the same result, it would be a blockbuster. The same paper reviewed 48 other longitudinal studies totaling over 100,000 participants and found that higher dietary intake of omega-3s was associated with a 20% lower risk of all-cause dementia and cognitive decline. In fact, for every 0.1 gram per day increase in DHA and EPA intake, there was an 8% reduction in risk of cognitive decline. That's enormous. These findings have been reported across numerous studies, and taken together, the evidence is clear. Omega-3 fatty acids support brain health across the entire lifespan, from fetal development to older age. Another very underappreciated role of omega-3 fatty acids is their ability to modulate the immune system, reduce inflammation, and even help regulate autoimmune conditions. Autoimmune diseases occur when the immune system mistakenly attacks the body's own tissues, essentially a case of overactive immunity gone awry. Conditions like rheumatoid arthritis, type 1 diabetes, multiple sclerosis, psoriasis, and Crohn's disease are all driven by chronic, misdirected inflammation. Omega-3 fatty acids, especially the long-chain forms EPA and DHA, help dial down this inflammatory overdrive. One key mechanism involves their ability to counterbalance omega-6 derived inflammation. Most inflammatory eicosanoids in the body are made from arachidonic acid, which is derived from linoleic acid, an omega-6 fatty acid found abundantly in the modern diet. EPA competes with arachidonic acid for the same enzymatic pathways, thereby reducing the production of pro-inflammatory mediators like leukotrienes and prostaglandins. More importantly, EPA and DHA are converted into specialized pro-resolving mediators, including resolvins, protectins, and myrisins, which don't just block inflammation, they actively promote its resolution. These molecules help calm immune overreaction by influencing T cell responses, macrophage activity, and cytokine signaling. Cytokines are the molecular messengers that ramp up inflammation, and omega-3s help blunt their production. Clinical trials have validated these effects, especially in rheumatoid arthritis. Multiple randomized control trials have shown that omega-3 supplementation can reduce morning stiffness, lower the number of tender and swollen joints, and decrease reliance on NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. Another area where omega-3 fatty acids offer critical benefits but rarely get the attention they deserve is eye health. While we often talk about DHA's role in eye development, particularly during pregnancy and infancy, fewer people realize that EPA and DHA continue to support retinal health throughout life. These long-chain omega-3s protect the eye from oxidative stress, ischemia, inflammatory changes, light-induced injury, especially in the retina, the part of the eye responsible for detecting light and transmitting visual signals to the brain. Observational studies have consistently shown an inverse association between omega-3 intake and age-related macular degeneration. In short, the more omega-3s you consume, the lower your risk of developing macular degeneration, a leading cause of vision loss in older adults. Omega-3s also play a role in protecting against diabetic retinopathy, a serious complication of diabetes that damages the retina and is the leading cause of blindness in working-age adults. Both animal and human studies indicate that DHA helps prevent or slow the progression of this condition. The PREDIMED study, which originally examined the Mediterranean diet and cardiovascular risk, also conducted a sub-study looking at eye health. Over 6 years, participants with the highest omega-3 intake had a 48% lower risk of sight-threatening diabetic retinopathy compared to those with lower intake. Moving beyond the eyes, one of the most transformative yet often overlooked areas of omega-3 fatty acid impact is mental health, particularly when it comes to EPA and its role in brain function and emotional well-being. These fats influence nearly every aspect of brain function. They regulate neurotransmitter activity, reduce inflammation, support synaptic plasticity, and maintain membrane fluidity, all of which are crucial for efficient nerve signaling and brain health. DHA in particular is a major structural lipid in the brain. The strongest evidence we have is in depression. Meta-analyses have shown that omega-3 supplements containing more than 50% EPA are associated with moderate to large improvements in depressive symptoms at doses as low as 1 to 2 grams per day. These improvements are thought to come not only from structural support in the brain, but also from anti-inflammatory effects that may counteract the chronic inflammation seen in depression. Omega-3s have also shown promise in anxiety disorders. Doses above 2 grams per day have been associated with significant reductions in anxiety symptoms. Likewise, individuals with ADHD often benefit from omega-3 supplementation, with studies showing improvements in attention, behavior, reading, and spelling performance. Joint health and arthritis is another area where omega-3s can offer real relief. These fats reduce the production of pro-inflammatory prostaglandins and leukotrienes derived from omega-6 fatty acids. They also inhibit cartilage-degrading enzymes like matrix metalloproteinases. Clinical trials show that even low doses of fish oil can reduce joint pain, stiffness, and improve mobility in patients with osteoarthritis. Omega-3 fatty acids are also essential to skin health. They support the integrity of the skin's outer layer, the stratum corneum, helping to maintain hydration and barrier function. Omega-3s reduce inflammation in the skin, help protect against UV-induced damage, and regulate sebum production, which is particularly relevant in conditions like acne. In psoriasis, a chronic autoimmune skin condition, omega-3s at doses above 3 grams per day have been shown to reduce scaling, redness, and joint pain. Some studies have even tested IV omega-3 infusions in hospitalized patients who have psoriasis and found significant improvements in symptoms, highlighting the powerful anti-inflammatory roles of these fats. In acne, EPA may help modify sebum composition and reduce the inflammatory environment in the skin. One study showed that 2 grams of omega-3 fatty acids daily for 10 weeks significantly reduced acne severity in adults. Perhaps the most fascinating is the evidence that omega-3s may protect against ultraviolet skin damage. In a randomized, double-blind, placebo-controlled trial, healthy volunteers took 4 grams of purified EPA daily for 3 months or a placebo. The results were impressive. EPA accumulated in the skin and reduced UV sensitivity. Participants could tolerate more sun exposure before developing redness, and skin biopsies showed less DNA damage after supplementation. Finally, omega-3s also support wound healing, accelerating the process by promoting anti-inflammatory signals and encouraging tissue growth. Now, let's talk about the liver. One of the most under-recognized health epidemics today is non-alcoholic fatty liver disease, or NAFLD. NAFLD affects an estimated 85% of obese individuals and is now the most common liver disorder in the world. It occurs when excess fat builds up in the liver of people who do not drink significant amounts of alcohol. It's tightly linked to metabolic syndrome, obesity, insulin resistance, and type 2 diabetes. And it doesn't just stop at fat accumulation. It can progress to non-alcoholic steatohepatitis, also called NASH, followed by cirrhosis, liver failure, and even liver cancer. Omega-3 fatty acids, EPA and DHA, may be one of the most powerful nutritional tools we have for addressing this condition. They reduce hepatic triglyceride synthesis, meaning they directly lower the liver's ability to produce fat. Mechanistically, this is largely due to suppression of a transcription factor called SREBP1C, which acts as a master switch for de novo lipogenesis, the liver's process of creating new fat. Omega-3s churn off fat production in the liver by flipping this switch. They also inhibit PPAR-gamma, another transcription factor that promotes fat uptake and storage in liver cells. By blocking both fat creation and fat storage, omega-3s help reverse the buildup of liver fat at its root. And because triglycerides are part of the same fat synthesis pathway, omega-3s naturally cause a significant drop in serum triglyceride levels, which is why they're so often prescribed in hypertriglyceridemia. But their benefit doesn't stop there. Like in other tissues, omega-3s exert a powerful anti-inflammatory effect in the liver, reducing cellular stress that leads to fibrosis and progression of liver diseases. They also show measurable benefits on insulin sensitivity and glucose metabolism, 2 core components of metabolic syndrome. In one randomized controlled trial, researchers gave patients EPA and DHA from fish oil and assessed insulin resistance using a metric called HOMA-IR, which is calculated by multiplying fasting insulin and glucose, then dividing by 405. This number is an excellent metric of insulin resistance and sensitivity. A HOMA-IR number below 1.9 typically indicates good insulin sensitivity. A value above 2.5 suggests insulin resistance. After 6 months of omega-3 supplementation, the participants' HOMA-IR scores dropped by nearly 50%. A dramatic improvement in metabolic health. Omega-3s also significantly lower CRP, also called C-reactive protein, a key marker of systemic inflammation, while reducing visceral fat accumulation and increasing fat oxidation, the body's ability to break down fat for energy. They've even been shown to improve body composition by just being added to the diet without any other intervention. And remember, one of the simplest and most powerful indicators of metabolic health is the triglyceride to HDL ratio. Ideally, this ratio should be under 2 for men and 1.7 for women when measured in milligrams per deciliter. Omega-3s uniquely improve both ends of this equation. They lower triglycerides and raise HDL cholesterol, causing the ratio to drop sharply. We saw this vividly in the Inuit population we discussed earlier. Despite consuming a high-fat diet, their triglycerides hovered around 50 milligrams per deciliter, a phenomenally healthy level. Why? They were consuming 5 to 10 grams of omega-3s per day through their traditional marine-based diet. And finally, one area that deserves more attention because it directly impacts our quality of life as we age is the role of omega-3 fatty acids in muscle maintenance and recovery. Omega-3s have been shown to enhance muscle protein synthesis by activating the mTOR signaling pathway, a critical driver of muscle growth and repair. This is especially important as we age and face the risk of sarcopenia, the age-related loss of muscle mass and strength. Sarcopenia is more than just weakness. It's often the first step in a downward spiral of frailty, falls, and metabolic dysfunction, and in the loss of independence. In one study, older women who supplemented with omega-3 fatty acids for 6 months saw measurable increases in thigh muscle volume, hand grip strength, and overall functional strength. Another trial showed that 4 grams per day of EPA and DHA significantly increased muscle protein synthesis and boosted anabolic signaling in older adults, demonstrating that omega-3s can actually make aging muscle more responsive to growth and repair. Okay, we've talked through the broad and far-reaching benefits of omega-3 fatty acids, touching on brain health, cardiovascular function, inflammation, metabolic disease, eye health, muscle mass, skin, and more. And honestly, we've only scratched the surface. These fats are pivotal to human biology, and in my opinion, they're among the most essential and underappreciated nutrients in modern medicine. But even though science may give us a ton of data, I still come back to the same question when thinking about what's optimal for our health, and that is, what were our ancestors doing? When we look at traditional populations, we get powerful insights into what the human body has evolved to thrive on, without modern interference. These communities weren't shaped by industrial food systems, but by the land and sea, passing on dietary patterns that supported generation after generation. So, what do traditional cultures tell us about optimal omega-3 intake? The most famous example, of course, is the Inuit and other Arctic peoples. Their diets were rich in omega-3s from cold water fish, marine mammals, and other wild game. Estimates place their EPA and DHA intake at 5 to 10 grams per day, an incredibly high amount. And yet, they had virtually no cardiovascular disease, very low triglycerides, and high HDL cholesterol. Now, compare that to the average Western diet, where intake of EPA and DHA is often as low as 0.1 to 0.15 grams per day, a 50-fold difference in some cases. That's not just low, it's likely deficient. The Inuit weren't just tolerating high omega-3 intake either. They were thriving on it. And when these populations migrated to Denmark and adopted a Western diet, their rates of cardiovascular disease rose dramatically. Another fascinating group of people who I've talked about a bunch on this podcast are the Tokelauans of the South Pacific, a population whose traditional diet includes fish and coconut rich in omega-3s and saturated fat. Their omega-3 intake, around 300 to 500 milligrams per day, was still 3 to 5 times higher than in modern Western diets. And what were their outcomes? Well, despite heavy smoking habits, virtually no heart disease, low triglycerides, high HDL, and stable blood pressure well into old age. But again, once they migrated to places like New Zealand and adopted processed foods and sedentary lifestyles, their health patterns changed. Cardiovascular disease and metabolic syndrome began to appear. Then there are the hunter-gatherer populations in inland Africa, who had no access to the sea. Their omega-3s came from wild game, insects, nuts, seeds, and freshwater fish. And yet, their estimated EPA, DHA intake was still around 300 milligrams per day. But here's something else to look at. Their omega-6 to omega-3 ratio was close to 2 to 1. Now contrast that with modern Western ratios, which range from 15 to 1 to 30 to 1, overwhelmingly dominated by omega-6 fatty acids, primarily from seed oils like soybean oil, corn oil, and sunflower oil. That imbalance contributes to chronic inflammation, insulin resistance, and a whole spectrum of diseases that are now considered normal in modern life. What we learn from these traditional populations goes beyond just intake levels. It opens the door to a more nuanced understanding of why traditional people thrive on a large spectrum of omega-3 intake, and modern society does not. The one thing that remains consistent across all these groups is that these populations consumed very little linoleic acid, the omega-6 fat found in vegetable and seed oils. For example, EPA and DHA intakes ranging from just 300 milligrams a day in African hunter-gatherers all the way up to 10 grams per day in Arctic populations have both been associated with excellent health outcomes. But what's consistent across all these groups is that these populations consumed very little linoleic acid, the omega-6 fat found in vegetable and seed oils. And that low omega-6 environment may have allowed them to efficiently convert ALA, the short-chain omega-3 found in plants, into EPA and DHA. Even though their direct intake of EPA and DHA was modest, they may have been making up for the difference through effective internal conversion. This is important because linoleic acid and ALA both rely on the same enzymatic machinery, specifically desaturase and elongase enzymes. And when the system is overloaded with linoleic acid, as it is in the Western diet, those enzymes get monopolized by omega-6s, leaving very little capacity for ALA to be converted to the omega-3s we actually need. In other words, our diets don't just lack EPA and DHA, they actively block our ability to make them. There's also a fascinating evolutionary twist here. Researchers believe these African groups who lived inland developed genetically enhanced desaturase and elongase activity over thousands of years, allowing them to survive without ocean access. In contrast, populations living near the sea, like most of the world, never had to develop this adaptation. They got plenty of EPA and DHA through diet, so their conversion systems remained inefficient, and that genetic ancestral heritage likely includes most of us. Now, combine that evolutionary inefficiency with our modern seed oil-rich diets, and you've got a recipe for omega-3 deficiency on a global scale. Historically, many cultures seem to have known this, intuitively or through ancestral wisdom. Among inland peoples who lacked access to fish, the brains of hunted animals were rarely wasted and often highly prized. Why? Because animal brains are concentrated sources of DHA and EPA. In a world without fish, brains were the next best thing. And here's an interesting theory worth considering. What if our ability to convert ALA into EPA and DHA is the primary driver behind cognitive development? What if variability in this conversion efficiency, which we know exists and which differs from person to person, partially determines a child's neurological potential? We've long assumed that intelligence is mostly genetic, tied to the architecture of the brain. But what if part of what makes a brain more efficient, more adaptive, or more capable has to do with how well it was nourished with these critical fats during development? We already know that low omega-3 levels are associated with poor neurological and visual outcomes in children. But perhaps the true picture is more nuanced. Even modest differences in EPA and DHA availability during key developmental windows might contribute to lifelong differences in cognition, learning, and attention. Were Einstein and Newton just very efficient converters of ALA to EPA and DHA? I don't know. But if this is correct, if this theory holds water, then that means by giving omega-3s to children, you can potentially create the next Einstein or Newton out of them. It's a hypothesis worth thinking about, and one that puts even more emphasis on ensuring adequate omega-3 intake, especially during pregnancy, infancy, and childhood. So if I haven't convinced you by now that omega-3 fatty acids are essential for you, your children, your grandchildren, and anyone who's pregnant, then I'm not sure what will. But I have a feeling that you're convinced. So the question becomes, what should we actually do about it? Let's start with food. The most natural source of EPA and DHA is fatty fish, a powerful, direct way to get the long-chain omega-3s your body needs. But there's a catch. Our oceans have become the dumping grounds for industrial waste, heavy metals, and persistent organic pollutants. Mercury in particular is a major concern, and it bioaccumulates as you go up the food chain. Here's how that works. It starts with algae, also called phytoplankton, the original source of omega-3s in the marine food web. But algae can also absorb mercury from polluted waters. Tiny animals called zooplankton eat the algae, accumulating mercury in their little bodies with each phytoplankton that they eat. So if a zooplankton eats 10 phytoplankton, then each zooplankton has 10 times the amount of mercury as one phytoplankton. And then, if a small fish eats 10 zooplankton, then that small fish now has 100 times the amount of mercury that one phytoplankton had. If a bigger fish eats that smaller fish and a bunch more, then it now has 1,000 times the amount of mercury in it than the original phytoplankton had. And this is called bioaccumulation. At each level of the food chain, the concentration of mercury and other contaminants increases logarithmically. By the time you get to predators like tuna or shark, their tissues are loaded with heavy metals and other contaminants. So after hearing all that, my answer is yes, eating fish is still beneficial, but you want to eat low on the food chain. That means sardines, anchovies, mackerel, small short-lived fish from sustainable fisheries. These fish have low amounts of heavy metal accumulation and are among the safest and cleanest sources of omega-3s. Personally, I try to eat a can of sardines most days. It gives me around 1.7 grams of omega-3 fatty acids, which is a fantastic daily baseline. I also occasionally eat salmon, especially sockeye, which typically lives only about 5 years before spawning. Because of their shorter lifespans, salmon don't accumulate as many toxins as large, older fish. Still, I don't eat it every week. But for many people, the simplest, most reliable way to get enough omega-3s is through supplementation. There are 3 main types of omega-3 supplements. The first is fish oil. This is the most well-known form of omega-3 fatty acids. Fish oil typically comes in 2 formats, triglyceride form, which is more natural and bioavailable, and ethyl ester form, which is more processed and slightly less absorbable. I recommend the triglyceride form when possible. It's more compatible with your body's natural fat metabolism and tends to have better absorption. The second form is krill oil. Krill oil binds omega-3s to phospholipids, the same molecule that makes up your cell membranes. This makes it more absorbable than fish oil. It also contains astaxanthin, a potent fat-soluble antioxidant. The downside? Krill oil is usually lower in total omega-3 content, and there are questions about the sustainability of large-scale krill harvesting, as krill are a keystone species in the Antarctic food web. That said, some products do carry sustainability certifications, so it's worth doing your own research. The third form is algal oil. This is a great option for vegans and vegetarians. Most people don't realize this, but almost all omega-3s in the ocean originate from algae. Fish accumulate EPA and DHA by eating algae or by eating other animals that ate algae, also called phytoplankton. With algal oil, you're going straight to the source, but in a cleaner, more controlled setting. These oils are grown in closed systems using purified water, free from environmental contaminants. But there's a caveat. Most strains of algae used in supplements only produce DHA, and you can't convert DHA back to EPA in your body because DHA lies downstream in the metabolic pathway. Some newer products combine different algal strains to provide both EPA and DHA, and this is something you need to look for. If you're not vegan, fish oil remains the most accessible, affordable, and widely studied option, with proven benefits at clinically effective doses. So if you're going to take fish oil, here's what you need to consider. Omega-3 fatty acids, like omega-6s, are highly polyunsaturated, which makes them very susceptible to oxidation. And oxidized fats are not something you want in your body. They generate free radicals and contribute to cellular damage and inflammation. That means many fish oils on the shelf, if improperly stored or poorly made, may already be rancid and harmful rather than helpful. One study found that up to 50% of retail fish oil products exceeded oxidation limits. Another study out of New Zealand, known for its pristine waters, showed that 83% of fish oils tested had peroxide and anisodine levels above recommended safety thresholds. These are the standard markers of lipid oxidation. Another fascinating study found that fish oil without proper antioxidant protection, like vitamin E, was basically ineffective at lowering triglycerides. But when a small amount of vitamin E was included, just enough to stabilize the oil, the expected triglyceride reductions reappeared. The takeaway, oxidized fish oil may not only be harmful, it may also be ineffective. Contaminants are another issue. The oceans, as we discussed, have become repositories for toxins like mercury, PCBs, dioxins, and microplastics. Thankfully, most fish oils are molecularly distilled, a process that removes heavy metals and plastic particles. But PCBs and dioxins, which are fat-soluble and carcinogenic, are harder to eliminate. That's why I only recommend fish oils that are IFOS-certified. IFOS stands for International Fish Oil Standards, a third-party testing program run through an independent Canadian lab called NutriSource. They have no ties to the fish oil companies they test, and they evaluate it for purity, defined as the absence of heavy metals, PCBs, dioxins, and contaminants, oxidation status, ensuring it's fresh and stable and not oxidized, potency, to see if it contains the amount of EPA and DHA stated on the label, as well as label accuracy and shelf stability. I personally won't take a fish oil that isn't IFOS certified. It just removes the guesswork. You know you're getting a clean, stable, potent product, one that works as intended and won't cause harm. So let's say you've got your IFOS certified fish oil. What dose should you take? We know the Inuit consume 5 to 10 grams per day. Traditional hunter-gatherers got around 300 milligrams daily, but had very low omega-6 intake. In the modern world we live in, we're flooded by omega-6s. So to balance that, I recommend 2 grams per day of combined EPA and DHA, with a goal of getting at least 1 gram of EPA. This is a good target for people who want to maintain optimal health. If you're targeting more specific conditions like rheumatoid arthritis, depression, high triglycerides, then 3 to 4 grams per day is often more appropriate. In those cases, I prefer an EPA-rich formulation, and yes, there are non-prescription, IFOS-certified EPA-rich products available. For pregnant women, DHA is especially important for fetal brain and eye development. I recommend aiming for 500 milligrams of DHA daily, and if you're vegetarian or vegan, algal oil is your go-to. Just be sure it contains enough DHA and ideally some EPA too. I also recommend taking the triglyceride form of fish oil, as it's more bioavailable and better tolerated than the ethyl ester form. Honestly, omega-3 fatty acids are one of the most underappreciated and underutilized tools for human vitality. I didn't take it for most of my life simply because I just didn't know. But the science is there, and the benefits are profound. Now, my children, my wife, and I all take it daily. There are likely very few people living in the modern world who wouldn't benefit from optimizing their omega-3 status. My hope is that this episode gave you not only the appreciation, but also the confidence to use this knowledge in a way that fits your health goals. And that wraps this episode up. But let me give you a teaser for our next episode. We're diving into another fascinating, misunderstood, and essential nutrient, vitamin C. I know what you're thinking. We get it. Vitamin C is good. It's in oranges. But trust me, that's just the surface. We'll explore its role in collagen synthesis, vascular health, stress response, immunity, and much more, and why many experts believe our current daily intake recommendations are drastically too low. We'll go way beyond orange juice and talk about how vitamin C supplementation could be a game changer for your vitality. Thanks again for joining me today on this journey of discovery. I truly appreciate you being here, and I'll see you next time. Cheers.